Thahira, will you let us know if we're going over time in the chat?
Of course. Yeah, for sure. Okay, guys, thumbs up if you can hear us. I'm just kind of hoping it's working. Yeah, I'm going to give everybody a couple of seconds just to log on and just get. Okay, perfect. Perfect. I think we're good. Yeah, I'm going to give everybody a couple of seconds just to log on and just get.
You're going to go ahead and give us the questions that people have asked, or I have my list access also?
Yeah, perfect. I will for sure, inshallah.
Okay.
Okay, guys, we're going to go ahead and get started. Assalamu alaikum, everybody. Thank you so much for joining us on Mind Matters. This is our first mental health webinar that we are doing, and we have some amazing panelists with us today. I'm so excited for you guys to get to know them and for us to just dive a little deeper into mental health and take this journey together, inshallah. So May is Mental Health Awareness Month, and throughout the month of May, An-Nisa has been focusing on topics just related to parenting, to therapy and how to get therapy, and youth issues such as bullying. May is just the kickoff for a plethora of events and workshops to come, inshallah, of just everything related to mental health. And I see, as I was sending out the emails, I know that we have a brand new audience with us today. So I wanted to tell you guys a little bit about An-Nisa and what we do, just to get you guys a little bit more familiar. So An-Nisa is a social service organization that's located in Houston, Texas. We are a nonprofit working to empower, educate, and enrich the community by providing support, mental health care, educational programs, and any necessary assistance to help our community. We are advocates for people in crisis situations and so much more. You can find out more information about An-Nisa on our website, www.annisa.org. And with that, I wanted to tell you guys a little bit about our program today. So we're going to take a journey through mental health in a way that we never have before. We're going to be discussing topics, but mainly we want to hear from you guys. So we want to hear from our audience about what your questions are about mental health, about things that maybe you've been keeping inside. I would like to preface this by saying that all of the questions that were asked by our attendees will remain 100% confidential. So no names will be discussed, nothing outside of what you guys have asked will be discussed, inshallah. So today we'll be focusing on faith and mental health wellness. We'll be focusing on mental health red flags, maybe in you or your children. And last but not least, we'll be focusing on how to build a good relationship with your therapist once you've taken that step of just getting help and giving yourself a happier life. So tonight on our program, we have Dr. Suzy Ismail, Thahira Ahmed, LPC-S, and Fizza Butt, LPC-Associate. I would like to jump right into it by introducing Dr. Suzy Ismail. We are so happy to have Dr. Suzy on. This is the first time that Dr. Ismail has been a part of an An-Nisa program. So please, everybody in the comments, please give her a super warm welcome. We're so happy to have her on. Dr. Suzy Ismail is the founding director of Cornerstone, a nonprofit faith-based communication intervention organization with several locations around the world that focus on youth, family, marriage, identity, socio-emotional wellness, and relationship rebuilding. She is the author of many books, including Modern Muslim Marriage, 9 to 5, When Muslim Marriage Fails, and several other works. She specializes in educating and empowering women, youth, and vulnerable populations by presenting a range of workshops, lectures, programs, diversity seminars, and corporate trainings, both nationally and internationally. So everybody, please give her a warm welcome, Dr. Suzy. You're up.
Okay, perfect. Thank you so much, Thahira, for that introduction, and thank you everyone for joining us this evening for an incredibly important conversation. It's definitely an honor to be with this organization, An-Nisa, which I truly respect the work that you do. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. So, I want to kind of dive right into the topic by addressing some of the misconceptions that surround, seeking mental health care, particularly within our Muslim community, but also across many different faith-based communities. Many times when we think about, the seeking of mental health care, there is almost a feeling that the seeking of professional mental health care is at odds with our faith. And many of us have heard consistently that when someone maybe speaks of their sadness, speaks of their difficulty, speaks of anxiety, the response can often be one of an invalidation of what a person is going through, and a response that is tied back to the idea that the person simply needs to increase their faith. They need to increase their prayer. They need to focus on the good that they have. They need to express greater gratitude. And while we know that the spiritual component of wellness is an important component of wellness, we also know that it's not the only component of wellness. And we often, utilize the example that if a child has a stomach ache, if a young woman has back problems, if an elderly male has difficulty lifting his arm, our response to that person and that person's pain would not be to invalidate it. Our response would be, let's seek some medical help. Let's see what's going on here. Let's address the problem, and let's follow through with remedies that can help ease this pain and ease this difficulty. And in the process, we also make dua, we also, pray for healing, we ask Allah to grant shifa, but that doesn't mean while turning to the spiritual, we completely neglect the aspect of seeking the type of care that is needed in any situation when someone is in pain or going through difficulty. And, within our own Islamic tradition, we see so many rich examples in which the importance of the validation of emotions, the understanding of the intensity of how the mental components and how both intrinsic and extrinsic factors can affect the emotional, the social, the relational, and how that can affect our lives. We see many examples of that in the Sunnah of the Rasul sallallahu alaihi wasallam and in the Quran as well. One of the examples that I often reference is an example that's, very deeply meaningful for me on a personal level, where we see in the Quran, for example, our attention is drawn to Maryam alayhi salam, the mother of the Prophet Isa alayhi salam. And it's so incredibly personal to me because when we look to our role models and we look to women who inspire us, I know for many of us, yes, we may look to our own families, our mothers, our aunts, we may look to popular culture. Maybe for some it's, Beyonce or, I don't know who else is popular these days, but Angelina Jolie or something, right? But even on a more deeply rooted level, for many of us, we do turn to our faith and we look to our faith for examples of role models that can guide us through, particularly our most difficult of times. And I know, with Maryam alayhi salam, her journey going through trials and tribulations and difficulties, while being constantly reminded in the Quran and through the Sunnah of the Rasul sallallahu alaihi wasallam that she is one of the women who is chosen, the 4 chosen women who are promised Jannah. To me, it's incredibly powerful to see her struggle and to hear the impact of the moment of difficulty and what she calls out in that moment and what the response in the Quran is to her. And so we know in the kind of the lifeline of Maryam alayhi salam that upon being born, her mother dedicated her to the service of Allah. And despite, all the difficulties of the social context of being a female, we're told in Surah Ali Imran that Allah Azza wa Jal accepts her into his service. And so she's raised in the mihrab, which is, the holiest place of the temple. And she's raised there as a woman of faith, where her uncle will come visit her, Zakaria, Kafalaha, her guardian, and he sees the fruits of winter in summer, and he sees the fruits of summer in winter. And when he asks her, where is this from? She says, Hada min indallah, this comes from Allah. And so we see this insistence on an unshakable faith. Yet, in the moment when Jibreel alayhi salam, in Surah Maryam, when we are told he brings her news that she will carry a child, her first response is one of shock, one of how can this be? I am chaste and have never been touched by a man. And we see that Jibreel alayhi salam reminds her of her unshakable faith and says that Allah can say kun fayakun, be and it will be. So she accepts that this is going to be her challenge, this is going to be her test. But that doesn't mean that during the test she's unbreakable, because she is a woman, she is a human that Allah has created. And so we see that when she's going through the hardest moments of labor and she's experiencing those crucial pains, she calls out to Allah and she says, Ya laytani mittu qabla hadha wa kuntu nasyan mansiya. Oh, if only I had passed before this and had been of those who were forgotten. And when we hear those words, so many times, clients, people in the community, individuals going through difficulty, youth that are struggling, they might say things like, you know what, I wish I wasn't here. I'm going through such a hard time. I don't know if I want to be here anymore. And maybe they're struggling with the weight of their difficulty. If our response to those young people is, come on, be grateful, get over it. Why are you complaining? Go pray. It's very much in a contradiction to what we see in the Quran. Because we see that the response to Maryam alayhi salam, when she calls out in pain and says, if only I had been of those who were forgotten, we see that in the Quran we're told, Nudiya min tahtiha, a voice calls to her from beneath her and says, La tahzani. She's told, do not be sad. And then she's commanded, Hizzi juz' an-nakhla, shake the trunk of the palm tree so that a date may fall. And then she is told to go back to her people, to not be alone, but to not speak, to point to the infant child rather than speaking. So many times when we're struggling with difficulty, when our children are struggling with difficulty, when they're going through hardship and pain and the world just feels too heavy, we might say to them, tell me what's wrong. Talk to me. Why aren't you telling me what's going on? How can I help you if you don't tell me? And yet over and over again in the Quran, we see that when people are going through their hardest moments, Allah Azza wa Jal tells them, you don't have to speak. Don't be sad. You don't have to speak. Don't be alone. Be with people, but you may not be able to speak. And sometimes within our own communities, that is the first step. Acknowledging and understanding that pain is real, difficulty is real, tests are real. That in the Quran and Surah Al-Baqarah, Allah Azza wa Jal says, لِنَبْلَوَنَّكُمْ بِشَيْءٍ مِّن, so we will test you with something of fear and something of loss, a loss of wealth, a loss of life. That sounds a lot like anxiety to me, being tested with fear, being tested with loss, grief, and trauma. So these are all aspects in the Quran where in our faith, and I know in many different faith traditions, the importance of recognizing and understanding the response to trauma, the response to difficulty, the response to pain, that it is a very, very human response to experience sorrow, to experience grief, to experience depression, and even at times to experience despair. But in the Quran, we're reminded, لا تقنطوا من رحمة الله. Do not despair from the mercy of Allah. And this is essentially when we see individuals who are going through deep emotions, who are struggling through trauma and difficulty, when it's left untreated, when we turn these people away and say, you're just ungrateful, you're not praying enough, you have to have stronger faith. Many times what we are doing are pushing them closer and closer towards that brink of despair. And if we are told not to despair of the mercy of Allah, we also have to ask ourselves, how can we possibly be a conduit of Allah's mercy? How can we be the ones that can help guide the friend, the child, the parent, the spouse, someone that we know who's going through difficulty? How can we help them? And not necessarily that each of us has to become a therapist, right? And how do we help ourselves? But knowing that there are avenues to seek help, that Allah Azza wa Jal grants us the means. Sometimes the answer to our dua is in finding that help in a counseling center, in a program, and seeking out the help of others. So recognizing and understanding, first of all, that it is not an oxymoron, it's not a paradox to say, faith is contradictory to seeking mental health care. Quite the opposite. I think they both go hand in hand, and it's important to be able to recognize that you are not necessarily, lacking in faith when you are struggling, when you have intense emotions. We know that Rasul sallallahu alaihi wasallam, the Prophet, peace and blessings be upon him, experienced a year of sorrow, right? An entire year of heaviness and sadness because of the loss of his beloved wife Khadija and his beloved uncle. So who are we to not experience those emotions? Who are we to rail and rant against feeling heaviness when we're tested? It's not necessarily an indication of lack of sabr or lack of patience. It's quite the opposite. When we experience this heaviness, when we go through difficult times and situations, and we take those steps to seek out the help, it is an active form of sabr. It's a recognition that this is our test, but that we are also going to have tawakkul, trust in Allah, that we will find the way out, but we will also seek out those avenues that Allah places in our pathway to help us out of that difficulty.
Thank you so much, Dr. Ismail. And honestly, you are so right? Pain is real, tests are real, and sometimes you just have to guide somebody in the right avenue, right? You just have to give them that push of saying, hey, it's okay to be sad. Being okay is sometimes not being okay is okay too, right? So just give them the extra push, right? Regardless of who it is. Sometimes I feel like we see very strong people go through these tests and we're just like, they'll be fine, they're strong, they can get through it. But, we never really actually know what somebody is dealing with on the inside. That's so true. Thank you so much. Up next, we have Fizza Butt, who will be discussing signs that your child might be in need of mental health help. Let's talk a little bit about Fizza. So Fizza Butt is a licensed professional counseling associate and a certified school counselor. She has been counseling children, young adults, and adults for the past 8 years. She believes that everyone deserves a chance to improve their situation without judgment. Her passion is to help clients discover their strengths, build a support system, and develop a healthy lifestyle. As a youth counselor at An-Nisa, she uses an integrated approach to counseling, which can include cognitive behavioral therapy, solution-focused therapy, and play therapy. Those who may be struggling with depression, anxiety, trauma, self-esteem, anger, loss, grief, abuse, or even behavioral issues can feel assured that they will get the support they need to get through their difficult situation.
I forgot you were talking about me. Just kidding. Assalamu alaikum, everybody. My name is Fizza, and Safa already kind of gave you my background. So this is, turns out that this is where I was supposed to be. It turned out to be a passion that I had no idea about. Working with kids, constantly being, I was a teacher for about 13 years, and this was just a natural way for me to go. And in this old age, I decided to do my LPC also. So alhamdulillah for, I thank Allah every day for helping me find a place where, a career where I can help people. And I love helping children because they are the future, of our world, if not our, our religion, but also the world, because, everybody starts off as a child, right? So Dr. Suzy was talking about having that mindset about having not having that idea that mental health is not a good place for you, a good avenue for you to pursue. We go to the doctor when we're sick, but mental health is like one of those things that has stigma still, not just in our community, but pretty much all minority communities have that stigma. So when we start thinking, I feel like our generation that grew up here has less of that kind of a mindset than our parents did. But we still have a long way to go because we want our kids to feel like it's okay to say that they're not okay. Okay, so let me give you some things to look for. So how do I know if my kid needs help or my child needs help? So let me help myself first. Okay, there we go. So number one, pay attention. It's 20% of the children between the age of 3 and 17 have mental health issues in the United States. That's 20%, okay? And American Muslims are 2 times more likely to attempt suicide than other groups. Now, there's 2 different reasons why they would do that. One could be religious discrimination, but the other one is the one that I want you to pay attention to, which is community stigma towards mental health. So that means that, they don't get the help they need when they need it. So you want to help your kids before they get to the point where it feels hopeless and then they start hurting themselves or something. So I'm just going to give you like 6 signs that you can look for. Easy remembering. At the end, I'll wrap it up and you'll be able to remember it. So, sometimes children are such a constant change. What your child was last year is not what your child is this year. So their personality can leave you wondering, does my child need therapy? I mean, I don't know if some people do ask that question. We might need a little work to do that. But sometimes these changes are so obvious that you're like, what's going on? This doesn't seem right. So some of the things that you can look for, okay? One thing you do look for is a defined behavior. You might say, I work with kids, so I know this happens because you have a lot of kids. I just feel like acting up today, so I'm going to do it. But this is like you're looking at something that is not normal for your child behavior to be. So most common signs your child may need counseling is like they get starting having behavior problems, both inside and outside of the home. Pay attention to what's going on in school, as well as in the house, daycare, wherever they go, pay attention to them. They might argue more. They might complain more. They might become more defensive. Even like the smallest thing can like trigger them. So those are the things you need to pay attention to. Are they changing? This is not my child's personality. Why is this happening? So another thing you got to look for is sudden changes in the usual interest and habit. For example, if they like to do something all the time, and their day-to-day habits, that can help you decide whether the child something's going on. Why aren't they eating? They're not eating the same way they did. They're not sleeping like they used to sleep. Their personal interests, little kids, they loved watching some kind of show. Which one? Paw Patrol. The little ones love that show, right? So they want to watch. They don't want to see that anymore. They don't want to do the things they usually enjoy doing. And if these changes are lasting more than 2 weeks, or it's like an extended period of time, you might just want to consider getting like a checkup done from the doctor, talk to the doctor. Doesn't mean you take them straight to the therapist. It just means that you need to be aware something's not right. And as a parent, you need to make sure that, everything is okay. I mean, I'm a parent too, so I know that I always want to make sure my kids are okay. When they tell me, Mom, this is what's going on. I don't feel good. I'm not sleeping well. Okay, you know what? We need to figure out why these things are happening. So these are some of the things you might have to look for. Another thing you have to look for is excessive worrying and sadness. So sometimes kids will be like the most easygoing kid. They're going out, they're going to school, okay, they're coming back fine. They're like, okay, bye, Mom, see you later. Suddenly they don't want to go to school. They're really, they're clingy to you. They're sad about something. And it's okay to be sad and worry sometimes, but when you see that this is a prolonged kind of a situation, then that's when you have to kind of look and see what can it be more. They might become too consumed. They sometimes, like I've had children who will cry the whole day because, like, this is in the middle of the school year. They will cry the whole day because they don't want to they don't want to be away from their parents. Now, they didn't do that in the beginning of the year, but they're doing this now in the beginning. So you need to find out, like, as a parent, I would be like, what's going on? And me as a school counselor, I always get calls. My child doesn't want to come to school. Is the teacher doing something wrong? What is going on? I want to find out. So you can, that's what I want to hear the parents do. Okay, what's going on? And sometimes, a lot of times it's not teachers. It might be somebody bothering the child, or maybe they just saw something in TV, or maybe something happened at home that got them so upset that they don't want to let go of the mom. Or maybe there was a home situation where domestic violence happened and the child is very clingy to the parent because they're protective of the mom. So you don't know what happened. As a counselor, I don't know, but at home, you have to, if that is what happened to the child, then you obviously have to take the child to the doctor and make sure that they are able to talk to somebody. But if you don't know what goes on, keep that in mind. Why is my child more sad than usual? Why are they worried about everything else? That's something you have to think about. And regression is another thing, like what they used to be like. As a young child, they're doing the same things again. Rather than developmentally going up, they're going down. Like, for example, now your child is 11 and they're bedwetting. There shouldn't be, right? Something is bothering them that they're doing that. They have frequent temper tantrums. You're like, why are they so mad about everything? What is upsetting them? There was nothing there that caused it. What is going on? Like I already mentioned, separation anxiety or clinginess. They are very anxious. They're very scared of things. They're always scared of things. Or they might regress into, like, young kids might, like, a 5-year-old starts talking like a baby, then you're like, why are they talking like a 2-year-old? Another thing would be social isolation. That is a big indicator. This is like across the board. Like, older kids do that a lot, where they don't want to be next to their peers anymore. They don't want to be around friends. They don't want to be around parents. They don't want to be around anybody. They just come home, they're in their room, doors closed. They don't want to eat with you. They don't want to spend time with you. That is a very big red flag to me, because I want to know why my child, who was fine sitting, playing, and talking to us, is not doing that anymore. Like children, they socially isolate when they're upset. They're eating by themselves. They avoiding meeting their friends and doing social activities. They don't want to leave the house for any reason. They're just like, just leave me alone. I'm going to stay inside my house. This is another one. This should be like, if a child makes some kind of a threat against themselves, like talking about self-harm. This is an urgent one, because if your child your child really well, right? So you when you look at your child, when you hear your child say something about, oh, I'm gonna do this to myself, take it seriously and just talk to them. Find out, are they serious? What are they talking about? What are their plans? You don't want to ignore things like that. In young children, what you want to do is they have the when they want to show that they're feeling like harming themselves, they express it in a different way than older children. Like, young children will say they'll hit themselves. They're banging their heads against something and digging nails into skin, or are like, these are some signs of young children harming themselves. For teens, it can be that, in school, I'm telling you, in a school setting, pretty much seen everything. Scratching, biting, burning the skin. I know that sounds very painful, but that is what they're doing. They're hurting themselves because they want to feel the pain. Sometimes it's because they're not feeling any emotions, and this is the only way they're going to feel something. That could be it. But there's a lot of things could be wrong. And that's why they need to go and see a therapist. Okay. Hitting or punching themselves, or the walls, or making, pulling hair. Some kids even go to whether we want to acknowledge it or not, some of our community kids are taking drugs and drinking alcohol. So we need to be aware why they're doing that. And they are doing it. So we want to make sure that we stop them and we help them out. Some people might see this as, oh my God, this kid is so healthy, exercising to the point of where they're collapsing or they're injuring themselves. That is also a way of self-harming, because this is the only way they're going to feel something. They're intense and they want to do it. Getting into fights where they know they're going to be probably the one more hurt than the other person. Okay. So if you are noticing any harmful behaviors, take note and help your child as soon as you can. Okay. They need that help. This is something that is necessary to make them grow healthy, because we have to acknowledge when they're in pain, they're not going to come out and really tell you that this is what's going on with me, and I need counseling. Some kids, I hope, do that, but a lot of the times parents are the ones who are going to have to take steps, especially when they're like preteens. They probably won't even know how to tell you. So these are some of the things that I want you guys to I know that was very intense because I was getting triggered by all of these things. But I mean, I work with elementary kids a lot of the times, but I can tell you that I have seen a lot of these things in them. And unfortunately, this is something we have to be aware of. So knowing is very important so we can take the next step and help.
Thank you so much for that. That's very true, right? I mean, like, nobody really knows a child better than the parent of that child would, right? So I feel like for me, I know that knowing these signs is just something that I would keep a lookout for, right? In my own children too, for sure, inshallah. So moving on, we have how to build a good relationship with your therapist, which is a question that was asked to us by a lot of attendees. Actually, one was how can I find a good therapist, and then how can I have a good relationship with my therapist, right? And I'm just gonna jump right into it with talking about this topic is Thahira Ahmed, LPC-S. Thahira Ahmed is a licensed professional counselor. She has more than 15 years of experience in counseling couples, families, and children. She enjoys helping adults, teenagers, and children work through their difficult relationship issues, heal from depression and anxiety, and cope with loss and grief, and recover from trauma and emotional abuse. She is experienced in trauma-focused treatments, interventions, and emotional regulation. Thahira?
I'm here. Thanks for making me feel old, okay?
I'm sorry.
No, I'm there. Alrighty. Looks like from my previous peers in this group, we've had some, at least we've come to an understanding that mental illness requires attention. I think that's something that we have understood. And it is not something to be afraid of. Seeking help, going to a therapist, there's nothing to be afraid of, nothing to be embarrassed about. Basically, if you feel you're suffering from any kind of mental illness, it is really, really important that you seek the treatment, you seek out and go see a therapist. Therapy is in a very, very simple terms, day-to-day language, common language, it's change. It's nothing but change. So if you're going to a therapist, the therapist is, in a very simple, in a very nice and simple manner to express this to you is she or he is going to help you make that change in your life. That's going to make you feel better, function better, overall, be a better person to yourself. So what are some points that are important in terms of, seeking this change or therapy? One is establishing a client and a therapist relationship. It's very, very important. The second point that I'm going to talk about today is the qualifications or the effectiveness of the therapist herself or himself. So first thing is a client and therapist relationship. This relationship is a very, very unique relationship, unlike any other relationship. As you can see, we have parent-child relationship, brothers and sisters, peers, colleagues, classmates, you have all kinds of relationship, but this relationship is a very unique relationship because this relation is so important that everything that change that you're looking for, the healing that you're looking for is based on this relationship. That's how to make therapy effective. You have to have a healthy client-therapist relationship. In the counseling lingo, it's called a therapeutic alliance. So how do we establish this? Varies with the therapist, frame of reference, where you're coming from, how you're looking at change. But there are three important elements that you would see across the board. I'm going to kind of briefly talk about them. The first thing that you would see in a therapeutic alliance is you need to kind of, see if this is something that is happening in your therapy sessions, is that if the nature of the relationship with your therapist is collaborative. Now, what does that mean? If you and your therapist can work together, it's very important that you are able to collaborate and work with your therapist. If you are going to butt heads with your therapist, or the therapist is going to be argumentative with you, it's not going to work. So first thing that you would keep in mind when you start working with a therapist is that check out the nature of the relationship, whether or not it is collaborative. You can work collaboratively with your therapist. The second element that you need to kind of keep in mind is if there is an affective bond between the client, that is yourself, and the therapist. What is this? This is how you can establish a close relationship with your therapist based on trust, mutual respect, and privacy and confidentiality. These are three elements that should be built in a relationship to have an affective bond with your therapist. So is this happening in your therapy sessions with your therapist? And the third point is the client and the therapist's ability to agree on the treatment goals and tasks. Studies have found that when you and your therapist work together towards some common goals, your outlook, your therapy, your outcome is much better. This is research. So if you can work with your therapist in terms of treatment goals, it's not like you're going to therapy and the therapist has a set of goals. If you said this is what you need, this is the treatment plan. Yeah, the therapists do that, but the therapist needs to work with you to make those goals and the objectives, because at the end of the day, you're the ones who's going to be, carrying out these objectives and working on them and making the changes in your life. So when we're talking about goals, it's very important that you have kind of an idea when you go into therapy as to what are you looking for in therapy. I do that all the time. When I see a client for the first time, I'm like, okay, it's nice to have you here, but what is it that you're looking for? Because what your agenda may be different from what the client wants, right? So it's very important for you as a client, before going to therapy, to kind of have an idea about what you need to work on. Goals can change later on, but at least initially you should have some idea about what you're looking for. Talking about therapeutic alliance, an important population that I'm going to address here, and Fizza also, talked about, children elaborately, is the children, okay? Establishing a relationship with children requires additional training. It's very important. The therapeutic alliance, especially working with, adolescent population, can be very, very challenging. I can tell from my own experience, I was initially trained in marriage and family therapy, right? I started working with families, And that's when I kind of realized that the children were being left out because talk therapy doesn't work with children. Most of the things that we do in family therapy with adults, the children are lost. So I'm like, there should be something, available out there for me to work with the children and kind of, include the family too. That's when I came across play therapy. And I've been a registered play therapist for a long time. And that's a modality that I use to work with families and with children, because that's the language the children understand, right? So play is a language that the children can express themselves in. They talk therapy is not very effective with them. Coming back to the adolescent population, how have you ever heard? I don't think there are too many adolescents who pick up the phone and call the hotline and say, I need therapy. They may call a hotline at crisis, but not to, call and get therapy sessions. Most often, adolescents, they come into therapy how? Because the school, they have problems in school, the teachers refer them, the parents bring them in, their pediatrician says they need help, or if they're juvenile, then they, if they're involved in the court, then the court will order them for therapy. So at the end of the day, they're not coming to therapy on their own volition. They're coming to therapy because they've been told to come. So you're going to get some kind of, pushback there in terms of working with adolescents. So if the therapist is not trained to work with this population, then it's going to be kind of a challenge for the therapist. And also not very effective, when it comes to helping the children. It's not going to help the child, and you're going to lose the child and not help the child at all. And you may probably say, I don't want to go to therapy anymore, and then the parent is going to have a hard time bring the child back into the counseling sessions. So that's one thing that we have to kind of, in the therapeutic relationship, remember that it's very important to have special training to be working with children. Another aspect of the relationship that I really, really, really would like to emphasize is, because I work with children a lot, is the parents' relationship with the child's therapist. It is very important when your children are in therapy. It's very important for you to have established a relationship with the child's therapist. Okay, parents are key agents in bringing about changes in their child's life. We all agree with that, right? So parent training can help the parent learn skills to improve their relationship with the child. Parenting training or parenting skills training is not about just problem solving or teaching them how to correct a behavior. It's about you teaching the parents how to be effective parents. Once they learn to establish a healthy relationship with their children, this empowers the parents. It makes them more and takes control of the whole situation. So helping parents is very important from the therapist point of view, and the parent needs to reach out and talk to the therapist. It doesn't mean that at the end of the session, every session you come and ask the therapist what happened in the session. That doesn't happen, because the child is our client. Confidentiality also applies to them, even though they're minors. We don't talk about the details of the session, but if there's something that is concerning, the part that you probably see in the session that you like to discuss with the parent, or the parent is seeing something concerning at home or in school and wants to talk about it, that's when we talk to the parents. And if there are skills that we are working on and you're telling the parents, okay, this is how you do this, I'd like you to do this between sessions, then, that's okay too. So that's where the conversation happens, but it's really important for you to establish a relationship with your child's therapist. The next point that I want to make in terms of, seeking therapy is that the therapist qualifications. It's okay to ask questions. If you have, seeking therapy for the first time, it's okay. You can ask your therapist, questions like, are you licensed in the state? How many years of experience do you have? What is your area of expertise? If you're going in there with a certain problem, for example, you want treatment for, you're seeking therapy for trauma, you can ask your therapist if the therapist is trained in trauma-related work. You can ask the therapist What kind of research is out there? I mean, what are some treatment options that have been shown to be effective in working with trauma clients? So these are some things that you can talk to your therapist, find out, make sure that you're satisfied that this therapist is going to give you the service that you need. Another question that you would also ask is medication. It's very common. People would love to kind of, find out if they need medication, how they're going to go about doing this. So these are some things that you can also talk to the therapist, and this kind of also helps you establish a relationship with the therapist. Sometimes it may not work for you. The therapist may not, you started therapy, you went for a few sessions, the therapist may not be the right fit for you. How are you going to know that? Okay, pay attention to some factors that makes you feel uncomfortable when you are in the therapy sessions. For example, when you go into the therapy session, do you feel kind of the room where you are in? Are you uncomfortable physically in the room? Does the space feel like it is secure and it's private? I mean, there's not too much noise, or you're kind of afraid that people may be hearing when you talk. So they'll make sure that those are some things that you like to kind of pay attention to. Are you experiencing overwhelming feelings of anxiety and panic when you're in the session? This is kind of a red flag right there. But however, one thing you have to remember is that some amount of anxiety is understandable. Some amount of nervousness, especially if you're going to a therapist for the first time, you're bound to feel nervous. Like you're going for an interview for the first time, you're nervous. It's similar kind of a feeling. But if this anxiety becomes very excessive and you're not able to sit in the session, or you kind of, having a panic attack, you need to let the therapist know. And maybe that's, there's something going on over there that is not, that's not helping you at all. Another thing that I would kind of ask yourself is, do you feel comfortable telling your therapist anything? Are you comfortable talking to the therapist? Was rapport established? Like, did you feel connected with the therapist, or do you feel disconnected? Is the therapist making you feel judged? Hey, or uneasy in any way, the way he or she is kind of, making comments or reflecting on what you're saying is there's kind of seem to be a little, judgmental there, value judgments. So that's kind of a red flag there. And is there any unconditional acceptance? The therapist is supposed to unconditionally accept the client. And do you feel unconditionally accepted? Do you feel understood by the therapist? Do you sense of some kind of a bias vibes coming out, like regarding your race, your color, your religion, your culture, the way you dress? Is there kind of a bias? Do you feel that the therapist is biased towards you? Those are, again, kind of makes you feel uneasy, and you kind of want to think about that. And is your therapist completely present with you throughout your session? I mean, total attendance. I mean, not getting distracted, being preoccupied with the laptop. However it is your therapist completely present throughout the session with you? This is very, very, very important. And do you feel validated by a therapist? So these are just a few things that you kind of red flags, so to speak, that you can look for to see, if this is, this therapist is the right fit for you. So what if you, feel that this therapist is not the right fit for you, or the treatment plan isn't working for you? If the treatment plan is not working for you, the goals that you've established are not working for you, you can always, always, always tell your therapist, and these can be changed. So these are workable. These are not hard and fast rules. You can always work with the therapist. Like I said earlier, working with the therapist, the outcomes are much better. But if you still feel the therapist is not the right fit for you, what can you do? You can always change your therapist. If you feel like you're not making any progress, if you feel like, this uncomfortable, and you don't feel that this therapist really helping you, you can always, always change your therapist. But rule of thumb, remember, Therapy takes time. Therapy takes time. The duration of the therapy depends on the individual needs. Therapist is not a magician, not a physician. There is no magic wand or a pill that will make you take away your pain. It's not going to make your pain disappear. So you will have to work with your therapist to make things work for you. Changing therapists without trying to work through the core issues will not help you heal. So if you want to really heal, all of these points are important, but just the drop of a hat, if you want to change therapists, you're more than welcome. You can do it, but it's not really helping you because therapy takes time and both of the therapist and the client need to work together to make it happen. Okay. Ultimately, if you're still not satisfied, again, you can always find another therapist.
I love the word therapeutic alliance. I think that's such a great term to use. And honestly, a collaborative relationship with your therapist is so important, right? Because at the end of the day, therapy does work both ways, right? So not only is the therapist putting in work, and I feel like a lot of the blame usually goes onto the mental health professional that they're not doing their job, but a lot of it stems from home as well, right? So there's homework to do, there's work to be done. So the client also has to be compliant for sure. Okay, so we're going to jump in for the sake of time. Let's try to keep our Q&A as short as possible. So I'm going to just direct a couple of questions over to our panelists. So we'll start with Dr. Ismail. So a question that came in was, when I am stressed out, it affects my body. I show physical pain, such as stomach pain and chest pain, and I am usually unable to do my work. Please let me know what a good coping mechanism is for these situations.
Okay. All right. First of all, Jazakallah khair, Sister Fizza and Sister Thahira. I feel like I learned a lot from both of you as well. And I think it was very good, practical tips that we can all kind of apply in our lives. So I really appreciated listening to both of you. And Jazakallah khair for the person who asked this question, because what you are describing is essentially psychosomatic symptoms that a lot of times when we hold our emotions in, when we hold our pain in, when we don't have the right outlets to be able to work through, whatever way we're responding to difficulties, we feel it in our body. And we often talk about trauma sitting in the body as well, and we carry it in different ways. I remember with my daughter when she was like in first grade, I think it was every day at the same time in school, she would have a stomach ache and she'd be in the nurse's office. And we couldn't understand why. We changed what she was eating. We did gluten-free. We changed, stopped dairy, all sorts of things. And now my daughter's like 22 now, but I still share the story because, eventually we found out that the reason why it was happening every day at the same time was there was something she was, a little bit anxious about within a class, a teacher who tended to be a little bit more strict or stern maybe with her students. And despite her never getting yelled at, she still felt that sense of anxiety, but couldn't put it into words. And so she felt it in her body instead. So what the person is describing is very common, and it is often an anxious response, a trauma response, a response in which the body is feeling the emotional pain. So one of my favorite coping methods is actually rooted in our deen as well. And I think it's incredible that, again, it's just so indicative of how our faith and seeking, mental health help are really tied together. Two elements within our deen, within the Muslim faith, known as muraqaba and hudur, mindfulness and presence, are very much an integral part of our practice of faith. So when we enter into our prayer, we are entering with that sense of mindfulness and presence. There's a beautiful narration of the Prophet, peace and blessings be upon him, in which his daughter Fatima radiallahu anha, in her adult years, came to her father and said that she was feeling overwhelmed, that there was too much to do, there was too much work in the household, that she felt like she couldn't do it all on her own and that she needed help. And so the Prophet, peace and blessings be upon him, told his daughter, "Shall I not teach you something that is better than the help of any other individual?" And she said, "Yes, teach me." And the Prophet, peace and blessings be upon him, taught her the tasbih, the pushing on each of the fingers, where we say Subhanallah, Alhamdulillah, Allahu Akbar 33 times each. And the reason why I say this is an incredible link to today's kind of Western conceptualization of psychology is that back in 2013, I believe it was, a study was released that showed that pushing on the uqlas, on the back of the finger, while chanting an uplifting mantra, something that is positive in repetition, actually activates senses within the body that work almost like acupuncture and release essentially the positive hormones. So it decreases the stress hormones and increases essentially the happy hormones. And subhanAllah, when we think about how this is part of our faith, we see that when someone is experiencing those bodily feelings, those psychosomatic symptoms, recognize that you are feeling something because maybe you're overwhelmed, maybe you're having an anxious episode, maybe you're struggling with some heavy emotions. Practice the practice of the Prophet, peace and blessings be upon him. You know, we often talk about the 5, 4, 3, 2, 1 method, looking around and identifying 5 things that you can see. And maybe it's a picture of your family on your phone. Maybe it's a verse from the Quran that you have saved, you know, on your laptop screen, or a painting in the room, something that brings you a sense of calm. Then 4 things you can touch. And in the act of touch, you know, practice this sense of muraqabah and hudur, of saying subhanallah, alhamdulillah, Allahu Akbar, but also maybe touching your clothing and feeling how soft it is, you know, touching a table and feeling how hard it is. Then 3 things you can smell, where you're inhaling deeply because at this point, you know, you're ready to breathe, but sometimes when you're in a heightened state of anxiety, you forget to breathe. So as you're working through the senses, you've already done the eyes, you've already done the touch. Now it's the 3 things you can smell. So you're inhaling deeply, and maybe keep some bukhur next to you, keep maybe a scent of something that uplifts you. And as you do that 3 times, you inhale through the nose and exhale in what we call an H breath that comes from the back of the throat. Then after that, it's 2 things you can hear. So you want to kind of sit quietly. And maybe there's a verse from the Quran that speaks to you. I know personally, لا يكلف الله نفسا إلا وسعها, which is on the Allah will not place a burden on a soul that is greater than that soul can bear. I have that everywhere, on my laptop, on my phone, around my house. Like that's my calming verse. Find your calming verse, find what brings you that sense of peace. So 2 things you can hear, you know, hit play, have it saved, maybe the voice of your child, maybe the voice of your mom, maybe something that brings you a sense of calm. And then the last one is most important, which is 1 thing you can taste. And the reason why it's so important is, you know, when we have babies, right, and they cry, even if they're not hungry, we give them a pacifier because that sucking motion brings a sense of calm. We actually don't lose that sense when we grow up. We just tend to not focus it as part of the healing mechanisms that we can apply. That's why we tend to see emotional eating where it involves, you know, food. But the sucking motion can be activated without necessarily, you know, going on a junk food binge. I usually recommend for clients in their toolbox to have a warhead candy or a Sour Patch, or some people like a black seed, or a chili pepper, even something that's going to cause the puckering to occur with the mouth, where you start to activate the sucking senses. And usually by that time, you've done the 5, 4, 3, 2, 1 method. It takes about 5 minutes or so. You're going to feel the release from your body of all of that pent up emotion. And then you make an appointment with your therapist. Then you go speak to your counselor and you work through what it is that you're feeling and carrying with you.
That's amazing, subhanAllah, how much like healing there is just within Islam, right? Just everything I feel like is all just headed towards healing, subhanAllah. It's crazy. Okay, so our next question, but actually I keep forgetting. So before we jump into our next question, I would like to request our audience to follow us on our Instagram platform, our Facebook, and subscribe to our YouTube channel as well. So that's right down there. Our Instagram is at An-Nisa Houston, and there you can keep up with all of our latest event updates, and maybe there'll be a Mind Matters Part 2. So just if you follow us on Instagram, you'll be able to find all of that stuff there, inshallah. So our next question is directed towards Fizza. The question is it better for a child's mental health and social interaction growth, I would say, to go to a actual like brick and mortar school versus online public school? Because I think it's becoming a very big debate now of like, should I homeschool my kids? No, but they're like, their social anxiety is going to get really bad. So what do you feel about that?
Ooh, since I guess I can be biased because I work in a school. No. But I thought about this question. I've thought about this question before too. I mean, this is a question that a lot of people will just ask, right? What should should I send my kid to school? It's easier if you're going to be home to keep them at home and have that online school going. It doesn't stop your life. You still can do whatever, it goes with your schedule. But the bottom line is, how do you think your child is going to be? It goes with your life, but does it go with your child's life? So each child is different. I feel personally that they need the social interaction. When they're at school, what are they learning? Yeah, academic is there. They can do that at home online. Yes, I understand that. But are they able to learn to deal with people who are so different than them? All of this diversity in a classroom is going to help them more accepting towards diversity. It also teaches them to problem solve, how if you can't be like the helicopter mama on top of this kid at school because they're in a class full of other 25 kids and they're going to learn to get along with kids. When they practice, they have to learn to do that. Even at school, I teach my students, I said, before you ask your teacher for help, if something's going on, you need to make sure that you try to take care of it yourself first, right? Yeah. I'm not as Islamically educated. Yes, I am a Muslim, but I would not put myself at the same level as Dr. Ismail and Thahira, because I know like both of them, the way they talk, they're very comfortable. But one example that a person in my standard can think of, Islam, I think, wants us to have that alone time, but it also encourages community, right? Look at how we pray. It is more rewarding if you go to the masjid and pray because you're with community, with a lot of people. So that social interaction is such a big, huge part of growing up and learning to deal with people. So I feel like, yes, it's okay if you have no choice and your child has health issues that they can't be outside. I understand that. But I feel like you are kind of like letting your child not experience what they're really supposed to as a child. And if you're, and I've seen like kids grow up too fast too when they're at home. They become mature faster because who are they surrounded by? Adults. So what are you doing? What are we doing? We're kind of like letting them miss that part of the childhood that they should have had in order to develop a certain way. So, like we have to weigh our options and kind of think. There's no right answer. Everybody's different, but that's just my opinion.
I feel like, for me, I feel like the parent knows, right? Like they'll know, okay, it's time for me to, I was homeschooled. I think I turned out okay. Yeah. But then again, like my mom took me out of school and began homeschooling me, I think, after I passed that stage of learning all of my motor skills and learning how to communicate properly. So I feel like middle school, if anything, is a really good age to take them out, or even, high school and stuff. So,
but you have to make sure you balance it, because if you're going to take your child out, then make sure they have places to go to interact with other kids their age.
Absolutely.
You have to make sure that happens.
So our next question is actually a very popular question. We got different variations of this question, I would say upwards of about almost 20 times. And that's, how can we control ourselves when we are about to lose our calm? So I would like to direct that question to Thahira.
Okay. I was going to talk about mindfulness, the 5, 4, 3, 2, 1. Our esteemed guest has already spoken about that. And that's what I was going to, that's what came to my mind is, one thing we have to remember is that whatever you're seeing is expression of, for example, anger, that's not the primary emotion. That's just what you're seeing is just the tip of the iceberg. There's a lot beneath it, or what you're seeing is only the secondary emotion. There's a lot of depth, primary emotions that are built inside that you really are not able to see. And that's something that you would work through in therapy. And so during the process of working through in the therapy, yeah, this can happen. You can have meltdowns, you can have, anxiety attacks, you can have a lot of things that are going on. That's why you're in therapy. The therapist will help you calm yourself down during the session and also give you skills to take home. Mindfulness is techniques, you do it from a spiritual aspect, just like, the doctor was talking about, or you do it from a meditation aspect or yoga, therapeutic yoga, whether it be the breathing, exercises, muscle relaxation. There are so many different mindfulness exercises that are out there that the therapist will help you choose. We are all different. We all like to calm ourselves in different ways. So what works for me may not work for you. So it's when you make this, build this relationship with your therapist, the therapist should be able to help you make a decision as to what works for you. And then you will practice that during and between sessions. So I can't give you a general, exercise to follow up, but the one that the doctor just talked about is excellent, and that's what I use too. These the 5, 4, 3, 2, 1. It's very, very, very easy, very simple. Can be done in a very effective manner. You want to do it in a more psychospiritual what is that approach, or you can just do it as a relaxation technique. Either way, it works very well. I don't know if I answered your question.
No, that's perfect, because actually this is a great segue into our next question. So ideally, I would love you guys just to kind of give your input, all three of you, if you can, on our next question, because speaking of just how to maintain your calm, right? Our next question says that throughout the day, we're faced with so many different stressors, right? And we're just constantly having like an overload of information being thrown at us. And I feel like as of like these days, it's mostly bad news and very little good news. So you lay down in bed at the end of the day, and you just have all of these different thoughts running through your mind, right? So I would love to hear from you guys just a little bit about how can you declutter your mind at the end of the day, right? Like, how can you avoid like having those like midnight panic attacks or thinking of like the embarrassing things that you did throughout the day? Like, how can you do that? And Dr. Ismail, I would love to hear an Islamic perspective on this as well.
Yeah, of course. So I'll just answer briefly so that we can definitely hear from our other two speakers as well. I think to start things off, we do have to look around at our devices and the bombardment of our minds by the increase in devices, the isolation that does come from being so focused on Snapchat and Instagram and Facebook and Twitter and Be Real and all of these other social media avenues, or the consumption of almost an overload of information, because we can't necessarily tackle the intrinsic, which is internally how we're responding, or the feeling of overwhelm that we may have, without also looking at the extrinsic. What are we inputting into our minds that may cause the sleepless nights, that may cause the difficulty focusing, the hard time being able to zone in and declutter the mind, as you said. So one of the things that I kind of mandate with all of the couples that we work with at Cornerstone is implementing, and I kind of do this with families as well, implementing 5-minute time. And we start out with 5-minute time and we kind of build up a little bit. And essentially what 5-minute time is for parents, getting an egg timer and entering into each child's room at the end of the night, and sitting with the child for 5 minutes and setting the egg timer. There's no devices, no phones, no television on, no laptop, nothing. And just connecting with the child in those 5 minutes, letting the child say whatever it is that's on their mind. And then with the parents, between the couples, doing that as well, having an egg timer, setting the egg timer. Most of the time, couples will be like, oh, wait, 5 minutes isn't enough time. Let's set it for another 5. Let's set it for another 5. Because we're so not used to detaching that it's incredibly healthy and almost like rejuvenating to do so. So plugging in, basically like taking all of devices, keeping a central charging station, letting there be a deadline, maybe like 8 p.m., 9 p.m. And I will say, like, even within our own household, when my kids, again, they're much older now, but when they were in school and they would want to stay up late and say, oh, I have an essay, I have a group project. My response was always, we have a 9 p.m. cutoff for all devices, and that included me and my husband. And even if you had work to do the next day, then you would have to wake up, pray tahajjud, and then between tahajjud and fajr, it was incredible the amount of work that we could get done during that time. Or I would tell them, you know what, wake up 20 minutes before fajr and you're going to pray 2 rak'ahs, and then in that 20 minutes they would write like 6 essays. So I think sometimes when we also organize our days around our salah and have almost like, just like our salah is a detachment from the dunya, right? We're taking 5 times a day, we're removing everything from our life and entering into salah, like having this forcible detachment, particularly from our devices, on a regular basis.
I think that's an excellent way to wind down. Hey.
So do you guys remember, I believe it was right before Ramadan, Sheikh Omar Suleiman had his whole like disconnect to connect phase, and he just kind of like disappeared from social media and just kind of recalibrated and came back with this like amazing Jannah series that Yaqeen was brought out. So I think that disconnecting is honestly one of the best ways to declutter. Does anybody else have anything to add to it?
Hey, you know me, I'm not, my phone is somewhere else and I'm not. It is always on silent.
Okay, that's true. So is mine.
The evenings, yeah, disconnect. That's the main thing. It's constantly, looking at the screen and being occupied, overstimulating. I say this when I work with the parents and the children. I say them, they need to wind down. You can have them watching TV up until the time they have to go to bed. It's too much stimulation for them. A lot of parents, give them a bath, give them something to drink, stop all of this, the TV watching and all of these screen time totally, and that's, turn it out, turn the internet off. 9 o'clock. Sounds good. My kids are grown, so I can tell them.
I know. It's easy for you to say, huh?
Yeah, no, I mean, they can tell their children.
I think everybody's different, right? My thing is, when I'm on laying down, my unwinding phase is reading a book. And I'm not reading a biography, because to me, I mean, I live a life full of different biographies. I want to be in another world. So my books are my escape to another sci-fi, give me a mystery, whatever, something to take my mind off. And unfortunately, they're downloaded on my phone, the app. So I read off of my phone so I don't disturb my husband if I want to read for an hour. So I read a book. That has always been my thing since I was little. So I think each person has to find their own thing that helps them relax. Mm-hmm. Some people, they do tasbih. Some people, I'll read my book, then I'll lay down and I'll do my dua and I'm asleep. And sometimes my husband doesn't understand how I fall asleep so fast. So, I think it's everybody's to themselves.
Everybody's got something different.
It helps me a lot.
Yeah.
That helps me a lot. Yeah.
I go through these like phases, right? I'll like read a book, but then sometimes I like journaling, then sometimes I do my dhikr, or sometimes it's just like I just lay there and just, just like reflect. Okay, so actually that's all the time we have for today. I think Personally, I feel like we should definitely continue this. So maybe inshallah, we'll release a Mind Matters Part 2 and just do an open Q&A. I think that'll be pretty cool. But a couple of announcements before we end our program. So we have a community conversation coming up on actually this Sunday at 11 a.m. That's Central Standard Time. So we will be discussing generational differences and so much more in this one program. It'll be an open forum that's open to everybody in our community. The registration link is in the description below. So just fill it out and inshallah, we'll send you all of the information needed for the community conversation. So be sure to register if you're interested. And I would like to thank all three of our amazing panelists for joining us today. This was such a beautiful and amazing discussion that was so needed I feel not only in our community, but in every community, right? I feel like we can never talk about mental health enough, and just to be able to relate to mental health topics on a different level is so important for us as a community, right? So thank you three so much for joining us. We had such an amazing time today. We hope inshallah that we can see you guys again soon. So stay tuned for that.
Yeah.
For sure.
Thank you so much. Thank
All
you.
right. Guys, and to our amazing audience, thank you for joining us. We'll be back soon, inshallah. So, assalamu alaikum. Thank you for joining.